Hello guys, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic questions for upcoming staff nurse examinations. So the first question is, what is the purpose of side rails on the bed? Okay, in the hospital for each bed we can see the two sides side rails. Okay, so what is the purpose of using side rails in the hospital bed? Options are to prevent bedsheet to go away. Okay, to prevent bedsheet. Okay, bedsheet which we use on the bed cot, that is. And the next one is that to restrain the patient, or to prevent the patient fall, or all of the above. The right one is option C. So the side rails are we use to prevent the patient fall. Okay, to prevention of patient fall on the floor. Because of that, we will use the side rails mainly during the shifting or transmitting from one ward to another ward. Surely the staff nurse should aware about the on of the side rails. You have to keep upside of the side rails for the bed. Then only you have to shift the patient. So this is the main responsibility of the nurse during the shifting. The next one is the correct sequence of CPR, that is cardiopulmonary resuscitation. Options are breathing, airway, circulation. Option B, circulation, breathing, airway. Option B is the circulation, breathing, airway. Option C is the airway, breathing, circulation. Option D, airway, circulation, breathing. So the right one is option C. Always CPR is firstly the medical profession he has to keep on mind the airway clearance, and then go for the breathing pattern, whether the patient is taking a breathing or not, then go for the circulation. So the CPR is nothing but airway, breathing and circulation. This is the correct sequence of CPR. The next one is which of the nutrients are restricted in acute renal failure patient. So in the case of renal failure patient, which of the nutrients are restricted? Options are carbohydrates, proteins, fat and vitamins. The right one is proteins. So the proteins are restricted in the case of renal failure. The next one is which vaccine is firstly came in India against COVID-19 disease? Options are Covishield, Covaxin, Sputnik and Moderna. The right one is Covaxin. So Covaxin has the first introduction of the against COVID-19 disease in the India. The next one is which type of episiotomy is done commonly during which stage of labor? This is diplomatic question. Please understand the question. Okay, give the correct answer. Which type of episiotomy? Okay, which type of episiotomy is commonly? The main points are episiotomy commonly during stage. Which stage? Okay, commonly in which stage episiotomy we will do. And the next question is which episiotomy is commonly the doctors are performing. Options are option A, first stage and lateral episiotomy. Option B is the second stage, right mediolateral episiotomy. Option C is the third stage, J-shaped episiotomy. Option D is the medial fourth stage. Okay, medial episiotomy in the fourth stage. So the right one is option B. So commonly episiotomy is done in the second stage, and the common episiotomy procedure is the right mediolateral. Okay, so here we have the two answers. This is a diplomatic question. The next one is infected COVID place can be disinfected with the so in the case of COVID infected area or any place, any house, office, anything, which chemical and which product we can use for the disinfect that area? Options are spirit, Lysol, glutaraldehyde, sodium hypochlorite. So this is a right option. Sodium hypochlorite we will use for to disinfect the COVID-19 place. The next one is to administer large amount of intravenous fluid, administration for the blood loss patient. Okay, in the case of patient with severe bleeding, okay, severe blood loss. So in that case, which gauge of the IV needle you will use for the intravenous fluid administration? Options are 18 gauge, that is green color. Option B, 16 gauge, that is gray color. Option C, 20 gauge, that is pink color. Option D, any one. You can use any one. Options, the right one is option B, that is 16 gauge gray color IV cannula we have to use for the large amount of intravenous fluid. The next question is lochia serosa can be seen in. Okay, lochia is a discharge from the vagina after the delivery, that is puerperial period. Options are 1 to 3 days. Option B 4 to 10 days. Option C 10 to 14 days. Option D after 14 days. The right one is option B. So option B is the 4 to 10 days we can see the lochia serosa. 1 to 3 days lochia rubra, lochia serosa, lochia alba, that is 10 to 14 days. The right one is option B, lochia serosa. The next one is where you have to check the pulse. Okay, where you have to check the pulse in the case of CPR patient. If you are doing the CPR for any person, in which area you have to check the pulse? That is, options are femoral, radial, carotid and femoral. Not a femoral, two times are came. It's maybe the brachial. Okay. So the right one is a carotid. Okay, carotid pulse we have to check in the case of CPR patient. The next one is what is BMI for obese person? So what is the BMI? BMI rate in the case of obesity person. Options are less than 18, 24, 29, above 30. The right one is above 30. So when the BMI rate is above 30, those persons are called obese persons. The next one is which is the end product of blood coagulation? So in the case of in the process of coagulation, which is the end product? Options are prothrombin, thrombin, fibrinogen and fibrin. The right one is a fibrin. So this is the end product of blood coagulation. The next one is a contraindication for pertussis vaccine. Okay, pertussis is nothing but whooping cough. So which is a contraindication for the whooping cough, that is pertussis vaccination? Options are fever, malnutrition, convulsion, PEM, that is nothing but protein energy malnutrition. The right one is a convulsion. So when the child is having convulsion, so in the case the pertussis vaccine is contraindicated. The next one is which therapy for neonatal jaundice? Okay, so when the neonate having the jaundice, that is physiological jaundice. In the jaundice there are two types, physiological and pathological. So commonly for the neonates, physiological jaundice will be developed after the 2 to 4 days of delivery. Options are stop breastfeed, give oral feed, phototherapy, warmer care. The right one is a phototherapy. So we have to give the phototherapy for the neonate who is having the jaundice. The next one is kernicterus is a condition of. Options are alcoholic, drug abuse, liver abscess, jaundice. The right one is the jaundice. So when the blood serum bilirubin level is higher than normal, when it is reached to the brain tissue, this condition is called kernicterus. The next one is a complication of prolonged tracheostomy suctioning. So when you are doing a prolonged suctioning for the tracheostomy patient, what will happen? What is the complication? Options are nausea, oral infection, dyspnea, or hypoxia. The right one is a hypoxia. So this is a complication of a prolonged tracheostomy suctioning. So this is end of my class, guys. Thank you for watching.